Hello, 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 my friends. I guess I should take off my audiobook that I'm listening to. Hello, hello, my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, August 7th, and it is time to do another drop-in meeting. I have been recovering from tonsillitis, and I still have it. It's better, but we'll see how long my throat lasts because it was very tender yesterday. Hello, Donna. Nice to see you, my dear. Nice to see you guys. I'm simulcasting live. When I'm looking at Facebook, I'm looking here. When I'm looking over there, I'm looking at YouTube. So hello, Donna. But my camera for YouTube is right there. Ah, life, right? It's been a busy morning. Hi, Deborah. Nice to see you. Now, hold on. Let me check in here with Facebook. Okay. At least with Facebook, I started it in the right place. Yes. Hello, Facebook. Facebook, is your sound okay? Y'all hearing the sound? I don't look like I have any makeup on when I actually do have makeup on, which is crazy. That shows you how dark you have to make your makeup. Sid Pretty says, I never knew COVID could affect the bladder. Yeah, girl, we've been talking about that for a year and a half. If you get our newsletter, we have a newsletter in our magazine, and we've done research with it. We have a COVID cystitis survey going on right now. Hi, Lisa. Hello, Catherine. How are you today? Hello, another Lisa. Life treating you well? Here, give me 1 sec. Hold on. Okay. Alrighty then. Let's see if I actually have cheeks now. Yeah, look, I actually have cheeks now. Hello, Gay. Hello, Mary. Thank you. You know, it's weird. I just life affects us in so many different ways. It's just been, I feel like there was just like one thing after another, after another, after another, and I mean, things are better and my blood pressure's down. I'm barely using any medication now. So things are good, good, good. I have my wonderful Dandy Blend herbal coffee, iced coffee. Yes. Deborah says, I hope everybody's doing well. As well as can be expected. My dad hurt his hip, so I'm doing everything now. All the things that he was doing, like he was doing the dishes and he was doing the laundry, and I'm not doing that right now. So I haven't been getting. I got 6 hours sleep last night. I really need like 8 hours sleep, but oh, it is what it is. So we did have something funny happen. So for those of you who don't know, I'm the National IC Support Group Leader. I've been a support group leader for almost 30 years now. Anissa says, where do you get the coffee? On the IC Network website. Just go over to icnetwork.org and go into our shop, and you'll see it right there under low acid coffees. So in addition to running the IC Network, which is its own full-time job, I also care for my very elderly parents. And my dad is 99, my mom is 93, and my dad's been very mobile, my mom not so much, until he hurt himself last weekend. And he couldn't sleep in bed. He could not sleep. Every time he was in bed, it hurt. And so I'd get up at 2 in the morning or 3 in the morning, check on them. And he'd be sitting on the side of the bed like this. And I'd go in. It's like, Dad, are you okay? He goes, yes, it just hurts. Which is how you guys, for those of us who have pudendal neuralgia and sciatica and things like that, I went through an extended period where I could not sleep on my back without getting pain in my SI joint. And that's exactly where he is right now, is he has pain in his SI joint. And so, and I have been sleeping in the recliner because of my TMJ. I've been sleeping in the recliner for a year and a half because that's a whole nother story. Okay. So anyway, so I catch him and it's like, all right, you come sleep in the recliner. Then I was sleeping on the couch because I cannot sleep in my bed right now. And up and down, he's groaning, going and checking on my mom. So like 3 nights in a row, I got maybe 4 hours of sleep. And then finally, it was just like, and again, up in the middle of the night, gave him the recliner. Then I knew I wasn't going to sleep. I broke down Friday. I got up early and I went down to the furniture store and I bought a second recliner, which is now gassing off in my living room. Oh, you know, we'll see. We'll see. So anyway, enough about me. Thank you, Ruth. Thank you for the 200 stars. Thank you, Lisa. Thank you for the 100 stars. Jennifer says, got my dandy blend earlier this week. So far, no issues drinking it. Love it. It is my all-time favorite thing now. Dandy blend. Seriously, I can drink it all day. I will have 2 or 3 of these a day. No flares. Nothing. No flares. The bladder is perfectly happy, and my heart is really happy without the caffeine, which is good. Ciprity says, that's very interesting. Does COVID cystitis show up as a bladder infection or cystitis? All of the above. The bladder only knows one language: frequency, urgency, pressure, pain. So it's going to feel like IC. It's going to feel like an infection. It's going to feel like everything, because that's the only way the bladder can give you symptoms. So generally, COVID cystitis manifests as intense frequency, urgency, not so much pain. It is the cytokine storm. That is what they're seeing, is the cytokine storm that happens in the lungs is also happening in the urinary tract, and it is affecting the bladder, and it is affecting the kidneys, et cetera, et cetera. And in the rare case, for the very, very ill patients, are actually finding live COVID virus in the bladder. But those are for the very, very ill patients. Catherine said, you had DMSO surgery, but you're still hurting the bladder. Upsetting. Any comment? Honey, Catherine, DMSO, you're not understanding what DMSO does. And a lot of us don't know what DMSO does. DMSO, the brand name is RIMSO 50, is the only approved bladder installation for interstitial cystitis. Back in the 50s, let me give you a little story on DMSO because it's very interesting. So back in the 50s, they were trying to find a way to transport kidneys for transplant. So if they were trying to move a kidney from one hospital to another, if they put it on ice, the ice crystals damage the kidney. So it was a medical adventure here of, okay, here, hold on one second. All right, sorry. You just gotta let me do these things. I have to do these things every now and then. I'm trying to get my makeup right. My makeup looks weird. Okay, now my right cheek looks pink and my left, what did I do? Hold on. Oh my God. Please help me. Okay, this is very representative of the week that I'm having. It is what it is. My makeup's going to be weird. It's just going to be weird. I do have this. Okay, so I don't look like a ghost. I don't know why I look like a ghost today. I actually feel pretty good. Okay. Deep breath. I took my blood pressure medication last night. I'm good. Let me get a drink and we'll start over. Okay, let's get back to the story on DMSO. We are then Okay, so back in the 50s, they were trying to figure out how to move kidneys for transplant from one hospital to another. You put a kidney on ice, the ice crystals destroy the kidneys. So this was a medical adventure, medical mystery. How do we do this? And one doctor came up with DMSO. DMSO is a byproduct of the paper industry. It is part of paper waste for paper processing. And DMSO was found to be very, very effective at being able to hold kidneys at a low temperature without damaging the tissue. And so back in the 50s and the early 60s, they really thought that it was a wonder drug. And I interviewed the guy who invented DMSO, who did the research for DMSO. He was up in Oregon and also wrote the FDA, the paper, the drug sheet that came with RIMSO 50. So they all thought that DMSO would basically be a miracle drug that would cure all these diseases. And that's how they positioned it. And they made a lot of claims and they did a lot of research. And guess what? It failed. Every single research study failed but one. The IC study showed just a little tiny bit of success. And so based upon that, it was approved for interstitial cystitis. The challenge is that we really don't know the mechanism of action of DMSO. There are like 30 different mechanisms of action. It's a good penetrator. It can pass through tissue. It apparently causes all the mast cells to release histamine at once, et cetera, et cetera. And for those of us who have had DMSO, you know that when you have it put in your bladder, it is not a fun experience. Holding it in your bladder is not a fun experience. For some people, it's terrible. For others, it's just never, you don't feel good. And then it comes with a host of side effects too, like having a garlic smell. So it was back in the early 2000s that a researcher, C. Suba Packer, who was a pharmacology researcher, MD, who started trying to understand what DMSO did. And she was doing it on strips of bladder tissue from rabbits. And what she found is that if you put the 50% dosage, which was on the FDA recommendation, if you put the 50% dosage on plain bladder tissue, it causes it to go, and it causes the muscle to tighten, to contract. And in some cases, it was permanent. The muscles would not release. So she developed quite a bit of data on that. It wasn't just one experience. She did her research and she studied it extensively. And then she brought her data to the American Urology Conference. It was in Orange County that year. And that was one of my first conferences that I went to. And her data was stunning because they did not recommend the 50% dosage of DMSO. And so I went to every single IC doctor there. All the national specialists were there, from the Rob Moldwins to the Campier, all of them. They were all there. And I went to every single one of them and I said, what do you think about the DMSO data? And half of them were not surprised. We don't use it. And the other half were, well, there's a place for DMSO. What was amazing was the discussion that happened. So we then it was presented as a research paper. The researcher was allowed to stand up at the podium and share her data and take questions. And the first person who stood up was Dr. Raymond Rackley of the Cleveland Clinic. And he was blistering, not to her, but about DMSO. He said, we believe that the great majority of damage done to bladders that ultimately leads to bladder removal is caused by DMSO. This is why you will never see DMSO used at the Cleveland Clinic while I'm here. And it was a stunning moment in time to have the Cleveland Clinic say, we believe that DMSO is fairly damaging at the 50% dosage. And so then all the top doctors, they all had this very vibrant discussion that we were all watching, and I wasn't participating in it. I was just going, wow, 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 what are they going to say next? And finally, the consensus was that DMSO should never be used alone at 50% dosage. It should be used in the form of a cocktail with other ingredients like heparin or sodium bicarbonate, whatever the DMSO cocktails were at the time. And the intention of putting it in the cocktail form was to reduce the dosage to 25%, because C-Suba Packard's research showed that 25% was safe, 50% was harmful. Now, that was a very pivotal moment for everybody who was there, but a lot of local doctors were not there, and they were still using a lot of DMSO, which was really sad. She came back the next year with yet another even more damning study. By this time, DMSO was sold to a company. I don't remember the name of the first company, the first two companies that had it. I think it's owned by a company in England now. And then we had yet another tragic moment in DMSO history, and that is with contamination from, okay, hold on, I got to get this right. Okay. So then a couple of years later, one of the sales reps called me and said, we need to tell you something. And I'm like, okay. He said, well, we've got a real bad moment happening in time right now with DMSO. And I'm like, all right, fill me in. What's going on? So a manufacturer in China was making contact with compounding pharmacies and urology offices by fax. And they were saying, hey, man, we can give you really cheap DMSO. You do not need to buy the DMSO from the manufacturer. We've got great stuff here. And the office managers who didn't know the difference said, hey, man, we're all in it for a deal. Sure, we'll take it. And when they got it, the little bottles were identical. I mean, just virtually identical. So when the doctor was handed the bottle, the new bottle from this new source of DMSO, he really didn't even know that it was from another manufacturer. And he used it on a young girl, like she was 18, 19 years old, somewhere in there. It was industrial strength. It dissolved her bladder, dissolved it. It was an emergency of emergencies. Imagine having the most caustic substance put in your bladder, and it's literally eating it alive. That is what happened. And they ended up, became an emergency, had to go in, do surgery very quickly, remove her bladder, et cetera, et cetera. And I do believe that this happened a couple of times before the doctors realized that the office managers were buying a different source of DMSO. And then at a subsequent conference, Robert Moldwin brought this up in the IC class that he was teaching to other doctors and said, be very, very careful that you are only using RIMSO 50. Look at the bottle, make sure it's a brand name, RIMSO 50. Do not accept any other source of DMSO. And it was just heartbreaking. That's why I've ran out on this a couple of times. I just don't trust anything from China. I just don't. I don't. Heartbreaking. So in the end, it's now 20 years later, and DMSO is really barely used anymore because we have another bladder installation called a rescue installation, which is much more patient friendly. You don't hurt afterwards when you have this done. You just don't hurt you don't hurt as much afterwards. And so rescue installations are the popular popular bladder install now. So I would just be, I mean, I did 8 of them myself. I don't regret it. I mean, my only regret is that you would never, ever, ever try to drive home with a DMSO in your bladder. The only thing that I would just make sure that I would do is look at the bottle they use. Don't let them use anything other than the brand name. So there's a little bit of IC history for you. Weird, right? Sit Pretty says, I've tried everything to keep my cystitis in remission, and the only thing that has worked for me, and I know this sounds weird, is ginger root tea made with fresh ginger root. I drink it every day. Yeah, you know, I actually am playing right now with some herbal tea formulas, and ginger is definitely right in there. I don't remember the exact mechanism of action, but ginger is certainly potentially beneficial for calming inflammation and stuff like that. Palm says, what are in the rescue installations? Heparin and lidocaine, or heparin and marcaine. The most popular lidocaine is the most popular rescue is a combination of heparin and lidocaine. Sometimes they will use Elmeron and lidocaine, and if you happen to be lidocaine intolerant, they will do marcaine instead. All right, give me one more second. I got to try to fix this one more time. Hold on. All right. It is what it is. I'm done. I cannot do anything else with my makeup. It's done. Sorry, I'm vain. When you know you eventually going to have 500 or 1,000 people watching you, you want to try to get it right. Palm says, thank you. My urologist mentioned DMSO, so now I know to say no. Well, I mean, it's an option. It's but you know, you just want to make sure you know the issues. Catherine, let's see. Mary says, how would I know if my IC Optimist has run out? You can log into your member page and you can see that on our website, or you can just give us a phone call, or I can look it up for you right now if you want. Here, hold on. Let me just look it up because I'm not sharing my screen with anybody, and I can tell you. So normally when I do these meetings, I usually do a little 30-minute intro and then I take your questions. Didn't really have a 30-minute intro prepared for today because I've been slammed all week. I will tell you that I am preparing a presentation right now for the big global IC research meeting that is happening on the 27th and 28th. I was recording yesterday. It's too short. I have to add more to it. We're recording my presentation ahead of time in case there's a fire and I lose power. So that's really the only thing happening right now. All right, here, hold on a sec, Mary. Let me just take a look here real quick. And I can tell you. You're good through next February, hon. February 9th, 23. You're good. Lisa, how do you find live chats and videos? I had to stop short on the last one. You can go onto our Facebook page. I'm sorry, you're on our Facebook page. You can go over to our YouTube page. Most of them are recorded and stored. It's really rare that I delete one. The only one that I've deleted in the last 2 years is when I accidentally shared my password for my main website, and I couldn't figure out how to couldn't figure out how to cut that out. So I literally had a minute and I had to delete it. I didn't have a choice. But otherwise everything else is saved. Ruth says, your tummy is bloating. Does the icy belly ever go away? The icy belly is interesting. I've asked a lot of researchers about it. The general consensus is that the icy belly is basically inflammation. You can start in the morning with your stomach flat, and by 3 o'clock in the afternoon, you look 6 months pregnant. That's just inflammation in the belly that comes and goes. Mary says, you're thinking that dandelion has been bothering your bladder? Anybody else? There's no, well, unless you're allergic to one of the ingredients, that's the only context, because dandelion has 0 acid in it and 0 caffeine. And I've never had anybody say that it bothered them, but we are all unique. I was working with a patient this week who was completely intolerant to quercetin, and she couldn't do any of the supplements. She wanted to try supplements. She could not do any of the supplements, which was really heartbreaking. Anissa says, I'm having a hydrodistension with trigger points with rubber Evans on Friday. Ooh, excellent hands. Please tell Dr. Evans Jill at the IC Network says hi. He has been voted Doctor of the Year every year that we've done it. We stopped doing that with COVID. And so I have not had nominate a doctor for 2 years as part of IC Awareness Month. And I'm not really sure, between the fires and COVID, it was very, very hard for me to, normally I run IC Awareness Month, and but we have volunteers who occasionally step forward who help too. I haven't even written the press release yet. I need to do that this week. I'm thinking about suspending the poster contest, but not the meme contest, because we haven't gotten a lot of entries in the last couple of years. I don't know. What do you guys think of that? I mean, the poster contest is really an opportunity for patients to really play with art and to share how IC affects them visually. But I mean, you can see kind of just a steady decline, that we need to come up with something new. What's new? Somebody tell me, what can we do for IC Awareness Month this year that would give you an opportunity to be involved. We've done tweets of the year, we've done memes of the year, we've done Facebook timeline pictures, we've done posters. And the posters have always been very fun, but not too many people have been submitting them in the last couple of years. And it's $100 Amazon gift card if you get first place, $50 for second place, $25 for third place. So tell me what you think about that. Hi, Caroline. Hello, Debbie. Marie. Oh, my goodness, Marie. Thank you for 500 stars. I think that's the biggest donation ever. Thank you. Marie says, I found out what was causing my pain. A drug I was taking for breast cancer, an estrogen antagonist called letrozole. For 5 years, I suffered with bladder pain that when you came off of it, the pain went away, and I haven't had it since. I'm so glad, hon. So either the medication itself was chemically irritating your bladder, or it's a combination of the fact that you had dropped your estrogen levels so low that your bladder wall didn't have a lot of mucus, thus making it much easier for the medication to bother you in the first place. I would put you straight into that estrogen atrophy subtype. Mary says, my doctor wants to use lidocaine, heparin, gentamicin, and a steroid. Is this normal? Absolutely. That is a classic bladder instill. That's a classic rescue instill. And the only thing you don't have mentioned in there is sodium bicarbonate. Normally they put just a wee bit of sodium bicarbonate in there too, because when you alkalinize that solution, it penetrates through the bladder wall a little bit easier. Marie says, I drink dandelion all the time in place of coffee. Hey, David, long time no see. I hope that you're doing well. Tabitha says, do you know why someone with IC and hypertonic pelvic floor who had a complete hysterectomy due to endo would have spotting and cramping after 15 years? That, my friend, is quite disturbing. You need to get yourself right back into your gynecologist. That tells me that something's happening in your vagina. We have got to figure that out. I mean, seriously, you need to call your gynecologist tomorrow and let's get that checked. I do not understand why that would be happening, honey. I'm sorry. I don't want to alarm you, but as somebody who also had a complete hysterectomy due to spotting and cramping, I don't want you to go through any unnecessary trauma. I think the sooner you get that checked out, the better. Okay? Please? Please call them tomorrow. Hello, John. How are you? Hello, Lisa says, I haven't painted in over 10 years, but this sounds like a great challenge. Where would one submit the poster? Over on IC Awareness, icawareness.org. Listen, if just 5 of you will agree to submit posters, I will put it back up and we'll do the $100 the gift. And so I'll be announcing IC Awareness Month probably in 2 weeks in our live chat. David is doing good. Awesome. So I want to show you my my next reading project here. My next reading project is a book called The Body Keeps the Score: The Brain, Mind, and Body and the Healing of Trauma. So, you do understand now that we recognize subtyping. We absolutely know that IC is not a bladder disease. Probably for the great majority of patients out there, IC is a pelvic pain syndrome. And there are clear and distinct groups in the IC patient population. Some of you have Hunner's lesions. Some of you have estrogen atrophy. Some of you have chemocystitis. A lot of you have pelvic floor tension, which has caused ischemia, which is oxygen deprivation, which then causes the bladder wall to break down. Some of you who have pudendal neuralgia, which is a nerve issue, but quite a few of us have chronic overlapping pain conditions, IC, IBS, vulvodynia, TMJ, et cetera, extremely sensitive skin, a wicked sense of smell. And we now understand that context. That is called chronic overlapping pain conditions, and that is a central nervous system disorder. It is basically the equivalent of an injury to the central nervous system that is leaving the brain in a constant state of fight or flight. And that causes long-term muscle tension, et cetera, et cetera. So we know from the research that 80% of the people who develop chronic overlapping pain conditions have a major physical injury, but we also know that 20% have a history of abuse and bullying. And I was working, I'll share this story with you. I was working with, she was here. Oh, you know what? I can't tell the story. No, I can't tell the story after all. I don't want to violate any confidentiality. But let me just say that when children suddenly develop symptoms, we're going to look for, number one, injury. We're going to look for chemical injury of the bladder. Remember, if you've got a young child before puberty, a young girl before puberty, they don't have a lot of estrogen. Therefore, they don't have a lot of mucus in their bladder. Therefore, their bladder is going to be more vulnerable if you're giving them a lot of juice, et cetera, cranberry juice, soda, all that sort of stuff. We're going to look for physical injury. Also, have they fallen on their tailbone? Happens a lot. Were they in ballet or gymnastics or football and sustain an injury? But we also have to look at the role of bullying. And what toll does bullying and emotional trauma place on the central nervous system? And I have shared my story that I grew up in a neighborhood. I'm amazed I talk about it so much because I didn't talk about it for 30 years. It was so traumatic. I grew up in a neighborhood with a kid my age who became a rapist and murderer. And I was one of his early victims. Fourth grade. And I was afraid to leave my house I left my house, but I was scared. From 4th grade, 5th grade, 6th grade, 7th grade, 8th grade, 9th grade, 10th grade. And by that time, I think he was already in jail. No, he wasn't, but he was at a reform school. And then literally months after I went away to college, he raped and murdered my neighbor and tried to murder her boyfriend. Now I want you to think about what would something like that do to a brain? because I had bladder symptoms in 7th grade, right in the middle of it. I had extreme vulvodynia in high school, right in the middle of it. Got IBS in my 20s, right in the middle of it. Well, right after that happened. And I know that I am forever changed. I am a survivor. I truly believe that if I hadn't had that experience, I would not be the empathic support group leader that I am today. And I think that it makes me a better friend and a better support group leader. But the trauma is the trauma. And I'm very curious. I've always wanted to know exactly why these things happened. Because it profoundly changes your life. For some of us, our lives are. I have friends who were also victims who literally never come back to my county, even though he's long gone. So this is a book that talks about what happens to the brain during trauma, and it's rave. This is your brain on trauma, running for your life: the anatomy of survival. Prior to the advent of the brain, there was no color and no sound in the universe, nor was there any flavor or aroma, or probably little sense or feeling or emotion. Before brains, the universe was also free of pain and anxiety. So anyway, I hope to come back maybe later this fall and kind of go through this, because I want to understand it more. I want to be able to help you understand it. And I want to take the shame away. I want to take I'm not ashamed of it anymore. No, I'm not ashamed of it anymore. I mean, I was then, but I know it was never my fault. I know it was about him and not me. And I know that there were many victims, right? There were many victims, not just me. But I'd like to just be able to understand what it did to my brain and my nervous system a little bit more. So anyway, the body keeps the score. Brain, mind, and body in the healing of trauma. Let's see here. Palm says, can an anteverted uterus cause bladder pain? Is an anteverted uterus a posterior fornix syndrome? Does that mean that your front is facing back and the back is facing front? Or it's not upside down, is it? What does anteverted mean? I don't know what anteverted means. Hold on, let me Google it. A-N-T-E-V-E-R, anteverted. When you have an anteverted uterus, it tilts forward towards your abdomen. Oh, hell yeah. Is that going to cause bladder pain? Definitely. Definitely, because your bladder is in front of your urethra. And so here's your bladder, here's your uterus. If your uterus is tilting down and pushing on your bladder, definitely that's going to cause symptoms. Just like fibroid tumors that push on the bladder can cause IC symptoms. And we also have the research that proves that when you remove the pressure, when you remove the fibroid tumor, the bladder symptoms go away. I think that study found in 70 to 75% of the patients. So yeah, pushing on the bladder is definitely an issue. And also, guys, I actually took my model down here. I want you to, let's see. I want you to understand something here real quick. So hello, pelvis, right? Here's your pelvis. Here's our levator muscles, which are the shallowest muscles that we have. And I have to put my levators on, even though the magnets don't really work very well, to show you what I want to show you. All right. So, and this is a female pelvis because I'm sorry, gents, you cannot buy a male demonstration pelvis. I have tried. So the first thing I'm going to do is I'm going to put in the uterus and the vagina. And I have to get them to stick in a hole. There you go. All right, so we can see that is in place. We're going to stick in the bowel. And the bowel goes right back here. Okay, so now we have the bowel in here. So you can see the bowel sticking up. And here's the bladder. Here's the bladder. So we're going to stick the bladder in here, right? So you can see that the vagina and the uterus literally are connected to the back side of the bladder and completely interconnected. And that is why when they do a hysterectomy, they have to kind of gently separate the two. They have to separate the two and hopefully not damage the bladder. They're doing a vaginal hysterectomy, a laparoscopy assisted vaginal hysterectomy, which is what I had. You know, you've got 2 incisions on your belly or 3 incisions on your belly, and they go in and they detach ligaments, connective tissue, things that are connecting the uterus and the vagina to any other structures, and they gently tease it apart, and then they cut your cervix and pull it all out through your cervix. Well, and then after they do this, they do a hydrodistension to make sure they didn't accidentally cut your bladder. And I was working with a patient last week or the week before who came home from a hysterectomy with a catheter, and she didn't understand why. And they told her that they had actually sliced her bladder open when they did the hysterectomy. Palm says, let's see here, hold on a second. Palm, let's come back to Sjogren's syndrome. I want to go through this real quick. Okay, so Sit Pretty says, I used to have extremely painful pelvic muscles because my muscles stayed in a clenched position. Now I can't feel anything. All my muscles are completely numb. Did you have pelvic floor physical therapy, hon? You know, so remember here, now that listen, Western medicine fails the typical IC and pelvic pain patient because doctors play in their sandbox. Urologists stay in the urinary tract, gynecologists stay in the reproductive tract, et cetera, et cetera, et cetera. And they don't look at relationships and the fact that nothing happens in isolation in the pelvis. Nothing happens in isolation in the bladder. There are other structures that can influence bladder behavior. There's no doubt about that. And one of the biggest things that's going to influence bladder behavior is muscles. It's called the viscerosomatic reflex. When your bladder is screaming in pain, your muscles are going to get tight to protect you from that pain. That's called the guarding reflex. So we know that the bladder can change muscle behavior, but can muscles change the bladder behavior? The somatovisceral reflex. Is it possible for a pelvic floor muscle to change the way the bladder functions? And the answer is yes. Yes, because when you have a tight muscle, you have diminished blood supply. See, the thing about the pelvic floor muscles is that blood vessels go through them, nerves go through them. And if they clench down, they're clenching down over blood vessels and nerves. And so if the bladder is supposed to get 24 units of blood a day and it's only getting 10 units of blood a day because your muscles are so freaking tight, is that going to be a healthy bladder? And the answer is no, it's not. We call that ischemia, oxygen deprivation or nutritional deprivation. So, you know, Sit Pretty, I mean, you know, our therapeutic priority for somebody with muscle issues is to restore blood supply. And the way that we do that is with pelvic floor physical therapy. But there is a challenge here, and that is there's a group of patients who, no matter what you do, their muscles go right back into tension. They have physical therapy. Their muscles are relaxed. Their trigger points are eased. They're gone. With proper physical therapy. But the problem is they come back a week later or a month later. Why? Why? And that's when we have to look beyond the muscles to the bones, because it's bones that put long-term pressure and tension on muscles. And so the fact that your muscles were clenched all the time, I mean, that's really interesting. And do we have an idea as to why that was going on? I mean, sometimes it can relate to trauma in childhood. like breaking your tailbone and your muscles just lock down tight and you end up with vaginismus. These are the patients who have never had comfortable sex. Everything hurts. They dread going and having their annual exam and having a speculum put in because that will hurt. But for other people, it might be a tailbone broken out of position or healed out of position. It could be a bad SI joint, a bad hip, something like that. So why were your muscles so locked down? Another time, I'm just going to say this, I can remember when I went and saw I went to UC San Francisco for my second opinion in the spring of 1993. And I saw Dr. Marshall Stoller. And I walked into his office and he looked at me and he said to me, "You're in agony right now, aren't you?" And I burst into tears and went, "Yes." It was, I mean, the drive alone was agony because that was when my IC was just totally out of control. And, so he was just asking me the basic questions. And one of the things he said is, "Were you a bedwetter?" And I went, "I'm a little, like in kindergarten, maybe." And he said, "Were you ever punished for bedwetting?" I was like, "No, I don't remember that at all." He goes, "Well, for some people, parents can be so abusive that a child will clench their muscles all night long to avoid wetting the bed." And although I know that didn't happen to me, I will say in the last 30 years, I have worked with many patients that has happened to, that their muscle tension began in childhood for one reason or another. And then in another case that was actually this year, it was a man whose mother forced an enema on him every single morning before school. Forced it. So he wouldn't have to have a bowel movement at school. Even if, and you imagine the trauma that did to his pelvic floor, and his pelvic floor muscles were very, very tight. So sometimes pelvic floor tension goes right back to childhood and something that happened in childhood. So your pelvic floor is stuck and you're stuck in a guarding reflex. And if everything is numb, that means that your nerves are compromised, hon. That means your muscles are so tight, they're restricting blood flow to nerves. And now the nerves are breaking down, or they're not breaking down. They're just not functioning. Tammy said that's what happened when I had my right ovary removed. The doctor said he tacked up my bladder in just a few weeks. I started having IC symptoms. Sometimes when they do that, I worked with one patient who literally her IC began after a surgery like that. And about 3 to 4 months later, or 6 months later, somewhere in there, they went back in and looked in her bladder and they found a stitch had perforated her bladder wall, a non-dissolvable stitch. And that was causing all of her symptoms. And when they removed the stitch, her symptoms went away. Sally says, "Do you know if Hunner's lesions can cause a high white blood cell count?" I think it's possible, especially if you have Hunner's lesions that are caused by viral infection. Hunner's lesion, remember there are two theories about Hunner's lesions. Number one, it's neuroinflammation. And number two, we do have research that has found active viral infections in some patients with Hunner's lesions. So I would wonder if you had a viral infection. Cipriti says, "I've been having chronic bladder infection since the age of 3. I was raped at the age of 6, and that 100% changed everything. So I completely identify." Yeah, honey, I'm so sorry. I'm so sorry. It's. I think one of the gifts of going through trauma myself is that I'm a safe place to talk about trauma. And some of the trauma that patients have shared with me is nothing short of astonishing and very, very tragic. And I'm so sorry that happened to you. I'm so, so sorry. Palm says, "Kegels are a no-no for IC patients. Kegels are a no-no for hypertonic pelvic floor patients. If you have tight pelvic floor muscles, Kegels are absolutely to be avoided. Think about a Kegel is designed to strengthen muscle. The problem is our muscles are too strong. They're too tight. So the last thing we want to do is, so here's a normal pelvic floor, and this is overly simplistic. So just think this is a molecular example more than anything else. So along a lean muscle cell, a scrunched up muscle cell, right? And so here now you have scrunched up muscles, and you're going to do a Kegel. That's only going to reinforce tension on those muscles. Instead, physical therapists will often have you do something called a quick flick. And with a quick flick, it is like a 1 second Kegel. Here, I'm going to do it. Do it with me, my friends. You want to do a Kegel together? Okay. So the quick flick, we're going to focus not on the contraction, but on the relaxation. So with a quick flick, I'm going to contract for 2 seconds. And now I'm going to release for 6 seconds. So quick flicks are all about the relaxation phase. And you know, it's interesting when you get your pelvic floor assessment, oftentimes what the physical therapist will do is she will put her finger in your vagina or in your rectum, and then she'll have you do Kegels around it, right? So, right? Okay. So she will have her finger wherever it needs to be, and then she will have you do a Kegel around it. And what's so interesting is, you know, she'll have you do it like 5 times, 10 times. I could definitely see for me that my strength changed after like the 3rd contraction. And sometimes what happens is you have tight muscles in one area and loose muscles in another area. And so back in my earliest days, oh no, I broke my vulva. No, what? Where did it go? It broke off. Dang it. Where is it? Only here. All right. So actually my levator muscles, not my vulva. All right. So anyway, I've lost my levator tip. Go figure. So anyway, early on with me, what was so interesting is that my shallowest muscles, these muscles, my levator ana muscles, were very, very tight because they were compensating for weak muscles up here. Sometimes it can be on the left side, sometimes it can be on the right side, sometimes it can be low, sometimes it can be high. Your muscles are all over the place. You remember, you got muscles that go from left to right, front to back, and low to high. Oh, man. I'll have to see if I can find it and glue it back on. Can horseback riding cause any issues? My mom gave me milk of magnesia all the time as a kid. Yeah, horseback riding gets mixed reviews, but it doesn't take a rocket scientist to see that especially if you're sitting on a Western saddle. I mean, I grew up with horses. We had a horse. My sister had a horse. And I took horseback riding lessons for a couple of years. I was barn crew. I was never that good at it, but you know, you got your legs open, you got a saddle pushing right up in your tender bits where there's no bone to protect it. Of course, horseback riding has the potential of damaging your pelvic floor. Of course it would. And God forbid you be writing English and you're posting, you're going up and down, up and down, up and down, up and down, which means you're going down on your pelvic floor and up and down and up with repetitive trauma. And then if you fell a lot like I did, then you had the falls of falling off the horse. So Pretty said, horseback riding always gave me bladder infections from my underwear being too close and rubbing against my urethra. And said, you probably thought it was infection, but what it probably was a muscle flare, because they're going to feel exactly the same. Everything feels like infection in the bladder. A bullet wound would feel like an infection. A stab wound would feel like infection. Chemotherapy, a chemical injury to the bladder would feel like infection. Everything feels like infection because you only have two nerves in your bladder, nerve groups, that give you these symptoms: frequency, urgency, or pain. So the only way your bladder can get your attention and say, help me, is with all the symptoms that you would normally associate with infection, even though it's not infection. I would hazard to guess that if you grew up riding horses, that your pelvic floor would have been traumatized by that. Just like if you grew up riding bicycles, a lot of bicycles, or ballet, where you're taught to tuck your pelvic floor under for an extended period of time, those are all going to traumatize the pelvic floor. So Pretty said, pelvic physical therapy never worked for me. It injured me more than anything. Just recently saw a urogyne. I was ready for the pain with pelvic exam and I felt nothing. You didn't feel anything, but how were your muscles, hon? Were your muscles super, super tight when they examined them? And you guys, please remember, I'm looking at two computers if you're wondering why I keep looking over. Palm said, I went to one pelvic floor physical therapy. She used a probe that contracted my muscles and made it feel worse, guys. Now listen. Now listen here. When you go to pelvic floor physical therapy the first time, their job is to study your body. Their job is to study your pelvis. They're going to start externally. They're going to look at your legs. They're going to watch you walk up and down a hallway. They're going to look at your back. They're going to look at a core. You're going to tell them what your symptoms are. They're going to try to understand the body mechanics behind those symptoms. And then they're going to ask to do an internal exam. And the purpose of the internal exam is to touch muscles that they cannot reach from the outside. They're going to touch deep muscles. They're going to touch shallow muscles. And if they can touch a muscle and trigger your pain, that, my friends, is exciting. It means they found it. I call that your hallelujah moment. If they cause pain in that first appointment, do not be afraid, be excited. Your immediate question back is going to be, what are you touching? That is it. And hopefully they will tell you exactly what they are touching. So do not go back, for God's sake. I mean, go back. Don't stop yourself from going back because it hurt. If it hurt, they were doing their job in the correct way. And now they understand what the problem is. When you go back the second time now they know the area they're working with. It's a give and take. You tell them what feels good versus what's uncomfortable, et cetera, but do not balk at physical therapy because that first appointment was painful. That's actually very exciting because it means they found it. Now we have to figure out, what did they find? What are they touching? Lightning says, do I think that herbal medicine can offer some benefits? Ironically, I was talking with a nurse practitioner. We had a great long conversation, and we were talking about the status of IC therapy today. And when I started the IC network, I came into it as a pharmacologist. My research, my degree is in drug development. How do you make drugs? How do you make safe drugs? Right? And so it's not a pharmacist, it's a pharmacologist. It's in the lab. We're really trying to invent new medications. And of course, I gave that up because I love animals and I refused to do the research that killed so many animals. But when I started the IC network, I was still very traditional medicine. I was very academic. I talked about urination. I didn't talk about peeing. Believe me, I had a very, very non-herbal approach early on in the IC network. And then we had so many people coming forward with these absolutely quacky cures that I shut it down fast. I cried, but I was shutting it down fast. People who said you could cure IC by drinking lemon juice, sleeping on magnets, you name it. We heard it all in the early days. But here's the reality. There is a very clear place for alternative therapies now. And the American Urology Association guidelines do that. And my moment, I'll tell you the exact moment that happened for me. So when I started the IC network, we didn't sell anything for years. I paid for everything and then I ran out of money. And so I created a little store and we sold the IC, we sold books, basically books and heating pads and chair cushions. And that was all I ever wanted to do, right? I wasn't in it to sell stuff. And that was the time when neuromodulation InterStim was being pushed aggressively, because we only had Elmeron, we only had DMSO, and then we had InterStim. We had the sacral neuromodulation that involved surgery. And because I started the support group in Northern California where it was developed, I saw all the horror stories early on with InterStim. Patients who were not anesthetized, patients screaming bloody murder. And I asked a lot of hard questions. And the company was so worried about Jill Osborne at the IC Network, they sent one of their international sales rep to California to meet with me to talk about our concerns as a group. And our concern was, hello, you're not using anesthesia to do implants. Of course, patients are traumatized. And that discussion led to that, that led to a change in their protocol, which is good on Jill, good on the IC Redwood Empire. But what happened is that some doctors ended up creating chop shops, for lack of a better term. They started telling patients the only treatment was surgery, InterStim. And there was one in Colorado who was especially egregious. He did every patient he saw. He didn't tell them about diet. He didn't tell them about anything. He just said, I have a treatment for you. It's NeuroStim. And there were conflicts. There are a lot of adverse events with InterStim. And eventually some of these patients found the IC network and they heard about the early history of InterStim, but they were gobsmacked to find out that there were other treatments. Like your doctor didn't tell you about Elmeron. They didn't tell you about the bladder. They didn't tell you about anything. And she said, no. I was told the only treatment was InterStim. And, it was just everywhere. The marketing was, the message of the marketing, the subliminal message of the marketing, because I was at the urology conferences, was basically, those patients who drive you crazy, the patients who call all the time, the patients who annoy you the most. Well, you can get rid of them by doing this little implant. That's not what they said, but it was what was implied. This is how I interpreted that. And I had this one very heartbreaking discussion with this patient who experienced a very severe adverse event. And I was like, you know what? Patients need a safe place where you can see those options. If the doctor isn't going to tell you what's available, then we should tell you what's available. And that was when my brain opened up to alternative medicine, because alternative medicine is way more appropriate in some circumstances than a surgical procedure that some patients have died from. And so we started talking about alternative herbal therapies, nutraceuticals in about like 2005 or 2006. And I added them to our shop. And was thrilled that 5 years later, when the AUA released their guidelines, they said exactly what I was saying, that patients should try the supplements before they try the surgical interventions because of the less risk of adverse event. And I'm going to sneeze again. Allergies are really bad right now. So getting back to your question, Lightning, yes, I do believe that herbal medicine has has benefits. The ingredient that we look for specifically, well, number one, it depends upon your subtype. Remember, we're not all the same. We have diverse patient groups. For some people, they have Hunner's lesions. For others, they have estrogen atrophy, et cetera, et cetera. So just as Elmeron is not a one treatment fits all approach, Chinese herbal medicine is not a one treatment fits all approach either. We have to tailor based upon a patient's unique presentation. And then based upon that, we have a little bit of a guess as to what we want to try to do. So if that patient has estrogen atrophy or they have a diminished bladder wall, then doing something that contains chondroitin is the priority. Because we have research that shows that chondroitin is essential to the superficial integrity of the bladder wall. And so the ones that I'm most excited about are going to be the ones that contain chondroitin in it. Chamomile, peppermint herbal tea have a very nice antispasmodic effect, smooth muscle spasmodic effect, antispasmodic effect. Quercetin has been proven to be an antihistamine in research studies. That was the first research study that showed that some nutraceuticals could benefit IC. We now have at least quite large study of over 250 patients who took Cystoprotect for 6 months. Again, with very, very good results for many, but not all of those patients. So as the AUA says, they want you to try the supplements before you try the more aggressive therapies that have the potential of harming you. The side effects are fewer in alternative therapies. And of course, we also have to embrace the fact that there are other things that we can do on a daily basis to try to keep things calm. We have to work on muscles. We have to work on stress. Because when you're under intense stress, as we have all been the last couple of years, your brain intensifies the pain. When we take the stress away, the brain reduces some of the pain. Pain that is accompanied by stress and anxiety is intensified because your brain thinks your life is at stake and is trying to get your attention. Pain that is accompanied by laughter is minimized by the brain because you're laughing, therefore your life is not at stake. So we all have to take a step back and also look at our anxiety levels and our stress levels and not be offended when somebody says we do that. Every good pain management program, helps us understand context. Anxiety and stress are not going to cause IC, certainly, but they're going to intensify IC. And this is something I've really had to work on this year, the last 6 months. My stress level caring for my parents has been off the charts to the point that my blood pressure got very, very high. And which is crazy because I'm pretty physically fit overall, but I had gained at least 10 pounds over COVID. And my dad was working me up talking about politics. I had to stop and shut everything down. It's like, no, I don't want to hear it. My brother, I want to talk to him on the phone right now. He's all about politics. I can't do it. I'm trying to get my stress level down. So Angel says, we appreciate your channel. Oh, you're very welcome, hon. Does pre-leaf cause calcium bladder stones? I just got some for a special occasion dinner. Well, I think if you're using it every day, yeah, well, you don't eat pre-leaf like candy. That calcium has to go somewhere. But if you're using it, once in a blue moon, and less is more, maybe 1 capsule instead of 2 might be reasonable, but you're going to have to follow your doctor's instructions. If your doctor doesn't want you doing any calcium, then you shouldn't do it. Angel said, does prune juice need to be diluted for constipation? I would. Prune juice, man, prune juice is foul. It is. You ever try it? Oh my God. It's just so, I can eat prunes, no problem. I had 2 this morning. I always grab some from my mom because I give them to my mom. You asked me to drink prune juice and I just want to gag. All right. So, I would put it on ice and dilute it 2 to 1 with water. What's funny is my spine surgeon knows exactly that it's nerve related, but it's not his specialty. And the specialist won't help me because I take pills and I can't because I'm allergic to them. Oh, it's very difficult, hun. Big giant hug to you. I hope you have a good rest of the evening. All right, let me come back to Facebook here. Oh, there go the firebombers. Florence says, does anybody have PGAD, persistent genital arousal disorder? I've had PGAD. Pam says, any chance at 62 years of age that hormones can rebuild my bladder lining? If you give the skin hormones, if you give the skin topical estrogen, it will start to produce mucus. It's not rebuilding your bladder lining. It is producing that thick coating of mucus. Anissa says that she also was raped. I'm so sorry, honey. I mean, for my generation, it was just so common, and it's still common, and it's infuriating. Mary says, I have a uterus that tilts forward. Does that give me any symptoms? Certainly, it could. Linda said, I had my bladder sliced during a hysterectomy at the age of 40. It was the beginning of all my bladder issues. You were not diagnosed with IC until the age of 73. You know, Linda, the proof is kind of in the findings here because any of the damage from that bladder slice is long healed. The question is there scar tissue? Is there a contracture? And is there muscle tension? You know, the hysterectomy is a big surgery. It's the biggest surgery you can do for a woman. And I mean, you basically get hollowed out down there, and it's awful. I mean, having been there myself. But it causes a lot of trauma to muscles, and it can cause a lot of trauma to nerves. And so, Linda, I would be very curious for the results of your pelvic floor exam. Remember now in the new AUA guidelines, at that very, very first appointment, they're supposed to check your muscles. And if your muscles are tight, that is an immediately referral to pelvic floor physical therapy. No more waiting. Kayleen says, hey, girl, I just got off lunch for your birthdays, and you made the mistake of drinking a pop. Oh, we've all done that, my dear. But you know what to do. So what are we going to do? If you're having a bladder wall flare from eating or drinking the wrong food, the very first thing you're going to do is dilute your urine with some water. Don't drink a gallon of water, drink a glass or two of water. Then the second thing you can do is alkalinize your urine to try to remove any of that residual acid. So you could take some Tums, take a couple of pre-leafs, or you could do a little tiny bit of sodium bicarbonate in a glass of water. But you have to remember that sodium bicarbonate, baking soda, is sodium, and it can raise your heart rate. Raise your blood pressure. So we don't really recommend that, only for an emergency if nothing else is available. But consider alkalinizing your urine. You can also try some Azo bladder pain relief tablets to numb your bladder wall, and then you're going to have to ride it out, my dear. We've all been there. We've all had those flares. Vicki said, mine started right after an annual colonoscopy about a year ago. Any coincidence? Well, I mean, really, I can only think of two things, Vicki. I think concept number one is normally you start having your colonoscopies at the age of 50. I had mine when I was 50. I'm due for another one. And that means that you are now in estrogen atrophy. So there's a very good chance that it was just bad luck. But in the end, your estrogen levels were dropping, and you are now in what we call genitourinary syndrome of menopause. Without that estrogen, your mucosal barrier in your bladder gets thinner and thinner and thinner and thinner. Thus, its ability to protect your bladder from whatever's in your urine, whether it's soda or infection, is now compromised. And thus, it's not a disease. There's no disease process happening. It's just estrogen atrophy, also known as genitourinary syndrome of menopause, hon. And so if that's the case, doing a coating. Now, this is where Elmeron used to shine, because Elmeron had a bladder coating effect, but Elmeron is now associated with retinal disease. And so, and it's an oral medication with significant side effects. So again, according to the American Urology Association, they want you to try the supplements first. And so that's where bladder builder or bladder rest or cystomend or cystoprotect are going to have perhaps the best effect. Now, the other thing that we would think about, Vicki, is that, you know, your body's reaction to pain is to tighten muscles. And so if your colonoscopy was particularly painful, and or you already had a muscle injury and the colonoscopy was just kind of the straw that broke the camel's back, there is certainly a possibility that you could have tight pelvic floor muscles. And so I would want somebody to touch your muscles too, and let's see if they're tight. When you go to pee, can you start your stream right away? Or are you hesitating 5, 10, 15, 20 seconds before you can release urine? If you're hesitating, then that tells me your muscles are tight. Linda said, no pain until the last 4 years. Frequency, urgency had been your symptoms. You've had 3 bladder lifts, interstim, and laparoscopic exploratory surgery. So, honey, the fact that you've had 4 surgeries, we're talking about 4 events that can cause scar tissue, 4 events that can compromise muscles, 4 events that can compromise nerves. Another thing to think about is, do you feel a sensation of heaviness? So when you wake up in the morning, you feel pretty good, but as the day goes on, you feel heavier, like, you know, until finally by the end of the day, you're carrying a bowling ball around in your pelvis and you can barely walk, this extreme weight or heaviness. That is actually something called pelvic congestion syndrome. It's swollen veins, varicose veins in your pelvis, one vein in particular. And that's completely fixable. And so that's something else that I don't know if that can happen after surgery. It might. So that would be something else that they could check for. Marlea says, you rode and trained horses for 20 years, never had any problems at all, but damn, this old age dried up crotch has got to me. Oh, God. Every woman here can relate to what you just said. And here on YouTube, Tammy says, estrogen has helped me with vaginal atrophy. I enjoyed your talk about that online. Exactly. Man, that's really something I'm focusing on for the next year or two, is I'm building a new website on it, bringing a whole new program on, because there's just so many. It just infuriates me, the millions of women who've been told they have an incurable bladder disease, when in fact they just have estrogen atrophy. If your symptoms started after hysterectomy, if they started after Lupron, if they started after starting birth control, if they started with anything that affected your hormone levels, that's estrogen atrophy, hun, and that's not a disease. And it's completely treatable. It's going to be treatable with estrogen. A therapeutic priority is always going to be estrogen, because when you give that skin estrogen, it immediately plumps up, gets stronger, and produces that wet coating that skin needs. A lot of people don't understand that your urethra and your bladder are mucous membrane organs, just like your vulva, vagina, and mouth. They're meant to be wet. The wetness plays a vital role in their health. And when things start drying out, bad things start to happen. Symptoms start to happen. So we have to keep this tissue moist. It's meant to be moist, but it's not water moist. It's a hydrophobic layer, which means it repels water. It's actually the glycosaminoglycan layer. It has sugar in it and fat in it, for lack of a better term. And so, I mean, that's very diminished. I'm sure that somebody would say, no, you're describing it incorrectly, but that's just the simple way of looking at it. So using something like V-Magic or coconut oil on the outside is the closest you're going to get that would provide that coating, but it's never going to be as good as your body's own coating. And you get more coating when you give that skin estrogen. I have a whole new video, big video we just did on it. You can watch. Tammy said, it felt like sand rubbing sometimes. I didn't. You didn't want to put the estrogen on, or the, I don't understand, Tammy. You didn't want to put what, where? Mandy said, I just had this conversation an hour ago with my sister. I was telling her how much I love pelvic floor therapy. She's going to look into it after she gives birth to her second baby. Yeah. And my sister and I rode horses too. Kayleen said, I have an internal reevaluation tomorrow morning in physical therapy. I'm so upset about the atrophy. I wish I can cure it naturally. Well, honey, it's not a disease to be cured. It's just the loss of estrogen. Stop thinking disease. It's not a disease. And when you give that skin estrogen, it plumps up and heals. And they have, you can watch it under an electron microscope, basically get stronger and stronger and stronger. See, my urethra will hurt randomly, but now I know it's not a UTI. I think I'll need an appointment with the urogyn soon since he didn't do an exam. Yeah. Lisa, thank you so much for the 200 stars. Much appreciated that. Mandy said, good for you. Keeping my stress down is key. I can't do politics without anxiety. Yep. It's a trigger. I had, what's crazy is my brother, who's 8 years older than me, like literally started yelling at me over the phone right before the last election. He was like, or no, after the election, he was yelling at me, my nuclear physicist brother, because of how I voted. And his name is Jack. My name is Jill. We grew up as Jack and Jill. You look at us, we look like twins. We could not be farther apart. You know what I said to him? I said, Jack, here's the deal. You're not a woman, and you were not rescued from a rapist. Period. You will never understand my heart. You will never understand what that was like. And I could never support somebody who has a claim like that. And he was like yelling at me, like, stop it. Just stop it. You'll never change my mind. Can pelvic floor physical therapy help with congestion? No. Pelvic congestion syndrome is a swollen vein, and they have to treat it like a swollen vein. And so it takes an interventional radiologist to do that, and it's very, very treatable. But pelvic floor physical therapy would never fix a varicose vein. Linda said, didn't think I would need it after 5 kids, but now you're wondering. Girl, honey, after 5 kids, believe me, your pelvic floor is not the pelvic floor of a 20-year-old. Your pelvic floor has been changed, and getting into physical therapy is very important. Lisa says, I have great results with hormone replacement therapy as far as being dried up and sex drive, but pain is still there, unfortunately. Okay. So, and you had pelvic floor therapy 3 times a week for 1-hour sessions, did it for months, but I didn't feel it helped me. This is my personal experience. Okay. So Lisa, number one, I applaud you. You gave it a good shot. You gave it a very, very good shot. You're focusing on your skin health with the HRT, and hopefully just using the topical steroid is the most important rather than the oral. I mean, the topical estrogen rather than the oral estrogen. The question about the physical therapy is, number one, what did she find with your muscles? And number two, did it respond? Did it ever respond, or was it always going back into tension? Because if you went to physical therapy and she found that you had tight muscles, and she did the physical therapy, but no matter what she did, your muscles stayed tight, no bladder therapy is going to fix that. The appropriate question to ask is, can you look beyond my muscles to what else could cause pelvic floor tension, specifically what we call bony structure abnormalities. Do you have a bad hip? Do you have a bad SI joint? Do you have one leg longer than the other? All it takes is one leg longer than the other. If you have one leg longer than the other, right? So remember, your hips are supposed to be level, but let's say you've got a leg that's a half an inch higher than the other, right? So now we've got a slight tilt. When you walk, we have the slight tilt that is going to put pressure on one. So one side's going to be artificially tight, one side's going to be stretched. That is it's going to take a toll over time. You know, when you're younger, a teenager, in your 20s, your body's very resilient. You're not going to feel that. But girl, by the time you're in your 40s or 50s, there is something called wear and tear injuries. And I was working with a patient last week or the week before who had a half-inch difference. And they had given her lifts and she wasn't using them because she did not understand the importance of that. Very, very tight muscles. And they gave her the tool. She just didn't understand the importance of it. So again, I would want to know, did the muscles change at all with that therapy? And if they didn't, why? Is there a tailbone that was healed out of position? Bad SI joint, bad hip, bad knee, bad foot, something, anything. And she said, please message my husband. Politics hurt me. He loves it, but he doesn't understand what it does to me. I need to stay in my bubble. Yeah. And again, if you're a victim, if you were a victim, I'm not a victim anymore. I'm a survivor and I'm a strong bitch because of it. Let me tell you, in the best possible way. And I want you to be strong bitches too. Enough. Enough. We are going to fight for the next generation. And we must stop this violence against women. It's just wrong. And we have it good in the United States. We are very blessed to have been born in the United States. Can you imagine being born in countries where women are still property, like in the Middle East? You know, where you can't even go to have a gynecological exam, and your husband has to go with you or a chaperone, and they're not allowed to look at your body? Pam says, I need estrogen then. What should I ask for? I'm postmenopausal. Pam, I have a video over on the IC Network and on YouTube that kind of goes through all that. Estradiol, a topical estrogen. Lisa said, what surgical procedure can help fix pelvic floor dysfunction? Nothing. Well, it depends on what's wrong with your muscles, hon. My mother has a detached muscle. And so they could do a surgery to reattach the muscle. She had a hip replacement that went bad. But, you know, if your muscles are tight, surgery is not going to fix that. Physical therapy is going to fix that. Muscles, you know, and again, I don't have my biceps anymore, but I just got a new weight set. I'm going to be working on my biceps again. Okay, but think about, so your muscles are supposed to be long and lean, right? This is normal muscle tone. But when you tighten the muscle, it pops up, my little bicep right there, right? It pops up a little bit. That's a contracted muscle. And the muscle fibers are interesting because when the muscle fibers are at rest, they're like this. But when the muscle fibers are contracted, they slide in, and that's what creates this little bitty bicep, right? And then when the muscles relax, they slide back apart, right? Sometimes muscles get stuck and they're not sliding apart, and that's what we call a trigger point. And, you know, you've all had muscle knots in your back, and you normally have somebody push on it, right? And when you push on it, kind of rub it, it triggers the release. And that's what physical therapists do inside, because you can get a trigger point right down by your urethra. You can get a trigger point right by your prostate. You can get a trigger point right by your rectum. And that hands-on physical therapy is very, very important. So a surgical procedure, Lisa, is not going to be effective unless there's some sort of detachment. What is effective is very good pelvic floor physical therapy. There's a very good website, pelvicrehab.com. Now, remember, it takes special training to do pelvic floor work. We want a pelvic floor specialist certified in pelvic care. And pelvicrehab.com is a searchable database that will show you those who have the training. If you go to a physical therapist and they tell you to do Kegels, they are not trained correctly. We need somebody certified in pelvic floor or pelvic work. Okay, so Lisa, she found muscle tightness. Then she tried dry needling a few times. You had to stop. Oh, now, isn't this interesting? Lisa says, I do have an S4 back injury from 1991. It's been triggering more back pain and icy flares like they bounce off of each other. Right. Right. You know, and I was just going through that with my dad because he just hurt his lower back, and it flared last Sunday, and we were following dermatomes, and the dermatome is the area of the skin that each vertebrae/disc innervates. You know, the nerve that goes through that area innervates in your spinal cord. And you broke. Okay, wait a second. You have the injury. You broke your tailbone on a water slide when you were about 8. Yeah, and L4, exactly. And I have a ruptured disc at L4. Okay, so Lisa, I got to tell you about a tremendous success story that we had that directly came from one of these meetings. So, you know, we've been talking about subtyping. I've been talking about subtyping 5-6 years, and I always say you're an anatomical mystery to be solved. And I go through the Chris Payne 5 subtypes: Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, and chronic overlapping pain conditions, right? 5 core subtypes. You are an anatomical mystery to be solved. So one patient, and I've forgotten her name, I apologize if you're watching this, who came to one of these meetings, and she really resonated with the symptoms for pudendal neuralgia. She had pain when she sat down that went away when she stood up, and she had other signs that nerves were involved, that muscles were squeezing nerves. PGAD, persistent genital arousal disorder. So she gathered some information and then went to her urologist and said, I think I have PGAD. Or pudendal neuralgia. And the urologist said, I agree. I do think you have pudendal neuralgia too. So then she went to an orthopedic surgeon, and they wanted to try to understand a little bit more about her anatomy. And what they discovered is that her tailbone was out of position. So here's the back of the pelvis, right? Oops. So here's your spine, here's your sacrum, and here's your tailbone. And I want you to notice your tailbone is centered and it curves under. It curves under. And I want you to look at everything that attaches to the tailbone. The tailbone has a functional role. It actually helps us balance, right? But look at everything that attaches to the tailbone. Hers, instead of being centered, was to the side. And instead of curving under, was curving out. Her tailbone was curving this way. So something amazing happened. So it's like, okay, now we have a real physical injury that we have to work on. And so she spent the next year working with a variety of people, pelvic floor and a chiropractor, And it was a beast, but they were able to restore her tailbone to its proper position. She was homebound before this. She was unable to work. She lived in pain all day, every day. A year later, she was 95% better. She was able to go back to work. She was able to have a baby, and she was barely flaring. So for her, it was all caused by a broken tailbone that had healed out of position. Okay, so Lisa, look at this model here. If you have a tailbone that's out of position, the tightness will not stop. No matter what you do, the problem is the tailbone's locked down improperly in the wrong position and at the wrong angle. I think it'd be really, did you tell her that you had a tailbone injury? I think it'd be really interesting to get an x-ray or a CAT scan, get an idea of just the spatial awareness in there, for lack of a better term. Are things in their right position? And also, girl, this is, you need this book. This book was written for you. Breaking Through Chronic Pelvic Pain, a Holistic Approach to Relief by Dr. Jerome Weiss. So he was a urologist who back in the 80s saw bladder therapies didn't work for many, if not most patients. And he was the first urologist to dive into muscles, to understanding the role of muscles. And he became an absolute expert at working with muscles and trigger points and stuff like that. But what baffled him were the patients whose muscles stayed tight or the tension came back over and over and over again. And that's when he started looking at bones. And, and so after reading this book, which came out 2.5 years ago, he was the first one to really talk about tailbone injuries. And the irony is that I was doing a big virtual international IC conference, and I was in a meeting with some of the top researchers, and I held up this book and I go, guys, you have to get this book. The section on the tailbone alone is fascinating. And they go, Jill, we were talking about tailbone injuries 30 years ago. And I went, but you never told us. You never told the patients. Do you ever ask the patient if they have a tailbone injury? And he was like, no. Like, well, okay. So this book is a love letter to pelvic pain patients. It took him 15 years to write it. It is filled with success stories. It is filled with case studies. And again, the patients that fascinated him the most are the patients who had long-term chronic muscle tension. And so that's when we start looking at bones. We look at the tailbone, we look at the hips, we look at the SI joint. That makes sense. We look at the knee, because if you have a bad knee and you're limping, well, what is limping going to do to the pelvic floor muscles? Boom, 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 boom. That's gonna mess up your muscles in your legs and your pelvis. But the contribution that he made, that no one else was the first to do, was to talk about the feet. And he eventually found that once he started working with a podiatrist researcher and understood the role of the feet in causing long-term chronic muscle tension, when he went back to those patients with long-term chronic tension, they were not walking normally. And so what fixed them in the end was getting their walk corrected. So they were either pigeon-toed, duck-footed, they have ankles rolling in, rolling out. And this is a favorite picture of mine, because this is a picture of, let me get this right on Facebook too. So here is a healthy leg, a healthy ankle, and I want you to see that the shin goes straight up at a right angle. But look at what happens if your ankle rolls in. If you have an ankle that's rolling in, immediately your shin is at an angle. And then that angle becomes exaggerated in the femur and even more exaggerated up in the pelvic cavity, where the pelvic floor muscles on this side are now stretched and tighter. So we repair that ankle. We get a lift in the shoe. We work on everything like that. And so red flags that signal a problem of bunion deformity on the great toe that results from abnormal body mechanics. Ooh, and I gotta say, my favorite TV show right now is My Feet Are Killing Me with the podiatrist. The surgeries are gross, but they're fascinating. All right, so a bunion or deformity shows that you have abnormal body mechanics. While bunions are sometimes identified in the pediatric population, in most cases they take decades to develop. In particular, pronation of the foot leads to instability of the great toe and will typically result in the foot becoming visibly wider and not fitting well. Number 2, hammer toes are curvatures of the second, third, or fourth, or fifth toes. They occur when individuals with overpronation gain foot stability. Plantar fasciitis is pain in the arch or heel of the foot, which is present on arising from bed in the morning and from a seated position. Shin splints. I mean, he goes over everything. I mean, it's incredible. This book is insanely good. So let's see. Here we go. A 37-year-old woman had sudden unexplained onset of pain in her buttock and leg that radiated down to her heel. She began having pubic and vaginal pain, urinary burning, and rectal spasm. These symptoms suggested a lumbar disc herniation, a UTI, hemorrhoids, and colitis, but all of these problems were ruled out with lab tests and an MRI. Dr. Weiss's internal physical exam revealed pelvic floor dysfunction. My internal examination disclosed a short leg, SI joint instability, SI ligament laxity, and a tender sacrotuberous ligament. An x-ray of the patient's pelvis confirmed a short leg with a significant tilt at the base of the sacrum. A simple shoe lift and SI osteopathic manipulation combined with internal myofascial release to relax the pelvic floor relieved all of her symptoms. Here we go. 46-year-old fireman developed penile, perineal, and anal pain after lifting a heavy fire hose. Dr. Weiss's examination and nerve testing revealed a pudendal nerve injury for which he administered pudendal nerve blocks and internal myofascial release for 3 years. During this time, the patient had varying periods of relief, but unless he limited his activity, he experienced a flare. Concerned about the patient's limited progress and wondering if a biomechanical problem might explain it, Dr. Weiss referred him to me. I found SI joint instability and performed a series of prolotherapy injections to tighten the SI ligaments. I need to have that. This solved the problem. This patient had durable relief of his pudendal nerve pain, was able to discontinue his pain medication, and finally returned to work as a real estate agent. I mean, guys, Lisa, please get this book. It is life-changing, and it will really help you understand the mechanics of why you're in tension and what that does to your bladder and everything else, but most importantly, how to treat it. Okay? Love that book. Tammy says, with my IC pain, I have pain in the areas of my kidneys in the back. Do y'all have that too? Honey, there are muscles called the psoas muscles that are big, tight ropes that go up either side of your spine. And the psoas connects down in the pelvic cavity. And so when that psoas muscle cramps, that often causes low back pain. For mine, it almost always happens on my left side. And let me see if I can give you a picture of it. Remember, the muscles in your back and the muscles in your leg do reach down into and connect to the pelvis. Let me see if I can find a picture of that. Well, this is a picture of nerves, so it doesn't help, but imagine straight up the side of your spinal cord, you've got two really thick, ropey muscles, and they're called the psoas muscles. Is there a good picture in here? Well, Marta said, so if topical estrogen helps with atrophy in the vagina, but doesn't rebuild the bladder mucosal layer, well, it does. When you put the estrogen in your vagina, some of it crosses through to your bladder, and it will help your bladder cells produce mucus. Would taking it orally patch pelvis delivering hormone to the bloodstream, will that help rebuild the layer? No. Topical estrogen is considered the gold standard therapy, especially for the urethra. It's much less risky. When you're taking it by mouth or you're taking it through the skin, through like a patch or pellets, that creates a much higher risk of cancer. But topical estrogen stays in the skin. So if you use the topical estrogen vaginally, it is believed to reach the bladder. Does bowel health play a role in IC? I've considered seeing a gastrointestinal doctor to address possible IBS. It's very common for some IC patients to have IBS and vulvodynia. We call that chronic overlapping pain conditions. And often it's driven by muscles, or it can be driven by a sensitized nervous system. Gayla says, I have a Tarlov cyst plus 3 herniated discs in the lumbar region. Girl, you've got it. You've got very clear spinal issues that have the potential of affecting the bladder and triggering some of these symptoms. Good. Lisa says she's ordering the book. Good. You can get it right from the IC network. Get it from us. It's cheaper. Don't get it from Amazon. Get it from us. It's $6 cheaper because I have a deal with the author. He's 85 now. And the last I heard was not doing well. And this single-handedly is, in my opinion, the best book ever written for the pelvic floor patient. Obviously, I love our IC 101 book, and that's a good starter. But for those patients who have long-term chronic muscle issues, this book is the bomb. Like literally, my gratitude is endless. Good. I'm glad that I can help you guys. Really, really glad that I can help. All right. Well, listen, we've been going for a little over 2 hours now, and I have got to finish up this big presentation for this big international IC meeting. And so I'm going to do a last call for questions. Last call for questions. My presentation is on the state of IC support in the United States. If you find these meetings helpful, please think about becoming a member of the IC network, where you can get our magazine. You can buy heating pads, chair cushions, stuff like that from us too. And that's what helps keep me going. The journey is real. All right, last call for questions. Last call for questions. What is my compounding pharmacy? The Women's International Pharmacy. And their website is womensinternational.com. They're a compounding pharmacy that specializes in formulas for people who are sensitive. They don't pay me. It was my doctor who basically said, Jill, you're so sensitive. I'm not going to, we're going straight to the best. And so rather than giving me Primer or a brand name, which tend to have a lot of preservatives, he said, I know you, I know you're sensitive. We're going right to the pharmacy that can create a formula that should not irritate you at all. And that is the Women's International Pharmacy. Love, love, love them. My estrogen right now costs me about $70. They just raised the price. It was $50 for years. And they raised the price $10, I think, last year. With shipping, it's like $70 for a 3-month supply. Worth it. Worth it, worth it, worth it. I love them. Very easy to work with. All right. Any other questions? Boy, allergies are crazy right now. Crazy, crazy, crazy. Okay, then I'm going to call it. I will, because I got to go film something else. I will see you guys next week. Y'all have a great weekend. Stand tall, stand strong. Look everybody in the eye. You have nothing to be ashamed of. You know you're hurt. And just said somebody was hit by a car deserves care. You deserve care too. Okay? All right, my friends. Be well. I'll see you again soon. All right, YouTube. I'll see you later. Be well.